Alright, good morning. I'm going to do an incentive spirometry. So the first thing I'm going to do is check the patient's charts and see what the doctor has ordered and if they are going to go into an operation or if they're going to be a post-op patient. So I'm going to check to see if they're on any pain medications, to see what treatments they are on. And then I will coincide, especially if they're on pain medications for post-op patients. So I'm gonna got that done, and I'm gonna always introduce myself when I get to the room and check the patient's ID band, and then I would wash my hands and dry them, and then I would go ahead and put on the appropriate PPE like gloves, anything like that, and then I would assess the patient and listen to their lung sounds, auscultate their lungs, and then I would chart down their vital signs, all their vital signs. So today with the incentive spirometry, I'm going to do a volumetric exerciser for the patient. And so this here is the machine. And then it has a mouthpiece to it, and then it always comes with a chart that says female and male. So then I would go by their age and their height. And so I'm going to use me, and I'm going to do my age and height as an example on how to do this machine for the patient. So I'm going to be between 1900 and 1850 there, so I'm going to set it to where it needs to be. Now if they are a post-op patient or somebody that's elderly or anything like that, I can lower the inspired volume meter down to give them a goal to reach. And then as they get better, then I will raise up the little yellow thing here. That way they can get back to their full capacity that they need to be at. So with this, always check it before you give it to the patient. Make sure there's no cracks or anything like that. And then I will attach this to the mouthpiece to here. Now with this, there can be a respirometer here that will read anything like, so I can see what their tidal volume is and their vital capacity is of their lungs for their charts. That way the doctor can understand, see what's going on. When I do this, I'm going to before I perform it, I would take a deep breath in and exhale, empty out my lungs. And then when I go to inhale again, I put my mouth over this to make sure my tongue is underneath, not in it or anything, and covering the hole. That way we get the appropriate reading on it. So I take a deep breath in and exhale. So when you go and take a breath in, you don't want to exhale until this reaches the bottom to where it gets to the top is at the milliliter inspired volume label there. Now you can set this next to the patient's bedside, as they need to do it at least 6 to 10 times in an hour, just depending on the patient's situation. If they have been in surgery, then we need to make sure just start them at a lower level and give them a goal to work on that hour. And if they need something like a pillow or any cushion or something to help them when they sit up, to make them feel a little more comfortable, so that way they can hold it and don't feel as much pain. And if like they're an elderly patient or a post-op patient, we can raise the bed up just to where they're comfortable, still comfortable, and that way I can get them to have their good tidal volume capacity. And when you're all done, you can take this out and put it in the appropriate place, cover it up, that way it doesn't get contaminated by something else. And then you can place this in the appropriate bag off to the side. And at the bottom of every machine here, there's where you can put the patient's name, patient's room number, and the date, as they can take this home with them to continue to practice their volume capacity of their lungs. And when I'm done, I'll remove my PPE, wash my hands again, and then reassess the patient and listen to their lung sounds and then put down whatever their post procedure vital signs are. Then I'd always wash my hands before I leave the room, and I would chart on the patient's charts to let the doctor know that I have performed an incentive spirometry for the patient, and that way the nurses also know that I did an exercise with them.